Chantal, good to have you with us here on ENCA. I think many people are surprised to hear Ebola making the headlines again. What's happened?
Good evening. Thank you to have me. We are still doing investigation to know if this new outbreak is related to the previous outbreak in Equateur that happened in 2018, or to the one in North Kivu. So we are working on analyzing the samples and see if there is any linkage or if it is a total outbreak. So we should be able to have the answers in a few days from now.
It's an incredibly difficult time to be handling Ebola at the best of times. Now, of course, you throw in the mix of COVID-19, and in a country where health facilities are already stretched, this, I can't imagine, is an easy situation to handle.
Absolutely not. Absolutely not. Already to respond to an Ebola outbreak, it's very difficult in itself because, as you know, Ebola is highly contagious with a very high fatality rate. So it really requires a lot of human power, human resources, financial resources to be able to have a quality response outbreak. So on top of the one still going on in the North Kivu, plus the COVID pandemic going on, it's really a very big strain on a health system, which is already very weak. So it's quite challenging. It's not easy at all. It's very challenging.
UNICEF, of course, does incredible work around the African continent, but UNICEF can't do everything on its own, having to now deal with COVID and now Ebola. What's the kind of support that you're seeing on the ground, and what kind of support do you still need?
Absolutely, we can't do everything alone. So we are really working in the areas where UNICEF has a proven comparative advantage, which is working with the communities, to do sensitization, awareness on good hygiene behavior, so we can stop the spread of Ebola as well as the COVID-19. We are working on trying to stop the spread of the infection by putting in place infection control measures. So we are really doing what we do best, but as you say, we still need some support. So we need some other actors to come in to work on other areas like surveillance, like medical care. So it will be a joint effort with all the partners that respond into outbreak response, but also, of course, you can't do anything without money. So it will require, again, some support on the financial side so we can be able to respond to actually three epidemics, because we still have teams in in the east. We are responding to COVID, and now we have the new Ebola outbreak in Mbandaka.
When it comes to the handling of both Ebola and COVID-19, the DRC, like many African countries, Chantal, is not necessarily a nucleated area where it's one small city dealing with an outbreak. You have rural areas, often hundreds of kilometers away from each other. How does this kind of communication and assistance reach those areas that are far from the urban areas?
Yeah, it is. We have indeed logistic constraints. As you know, the roads in DRC, they're not very good. So you have almost to fly everywhere and to fly everything. So like we are talking tomorrow, UNICEF is flying cargo, 60 metric tons of cargo from Kinshasa to Mbandaka. So you have, which means that you really have the financial resources are very needed, because you have everything have to be flown from Goma to Mbandaka, from Kinshasa to Mbandaka. So it is a real challenge. And I think that also can explain why sometimes the information about outbreak does take time to come to the central level. Like this outbreak, we think the first cases were on the 18th of May. But because of all that, the communications that are not good, the information system, so we just have to work around it and to try to do our best with the means we have. But yeah, it's a really challenge. It's especially in the rural area, people, they're poor, they have no means, they have no communication. So UNICEF tries, that's why we try to work with communities. You know, in the villages we have we try to have committees in every village, so they are trained. They can not only sustain the communities, but they can also share the information when there is something abnormal that happens. So so we don't work only through the health system, but really on the grassroots with the community. That's the only way we can try to overcome that challenge.
Chantal Mtoni from UNICEF in the DRC. All the very best to you and your team. I'm sure we'll be speaking to you in days to come. Plenty more for you here on ENCA.